All right, guys, and with that, we're into the official Strudel Step 2 study plan. So first off, we have this kind of Step 2 CK system specifications and then the task and competency specifications. So these are basically what the USMLE is saying is weighted on the exam based on these two kind of categories. So the first step in this kind of process, this Step 2 write-up, is overview videos. So really the purpose of an overview video is to help build a strong knowledge base. You're building your foundation. You don't want to be surprised on test day. You don't want to see something that you haven't seen before. You want to be aware of the most common things so that you have a nice working jumping off point for you. So one of the things that I used to do, and I would recommend to anybody, is that doing these types of things can be done during like downtime. So when I was working out, if I was driving to a rotation, doing stuff around the house, laundry, cleaning, whatever. This is stuff that doesn't necessarily require 100% laser focus, but it still kind of keeps your mind intact. It kind of keeps it running and keeps these new things in the front of your mind. So it's hard to work with or apply any information that you don't know because that's what step two is application of information. And if you're not aware of kind of the foundational things or what your options even are, it's hard to apply that and kind of work with it according to how they ask you. There are several options for overview videos. Emma Holiday is a little bit more dated, but they're solid. Dr. High Yield does a good job in a very short amount of time. I am personally a humongous divine intervention fan, and then online med-ed as well kind of provides a general overview of several different systems by rotation, which can be helpful in a lot of cases as well. So shameless plug alert here for the Strudel Rapid Review series and the rest of our content. You can see that we're going to start kind of tailoring these to the way that the USMLE tailors things. So here's this little this outline of how the Anking deck is kind of stratified and separated. So you can see it's separated by all of those different systems there. And then you can see our rapid review series next to it. Our hope is that we can finally get together a playlist that actually emphasizes exactly what the USMLE is going for. And then you'll be able to kind of follow through the Anking deck with our videos at your side as well. So Michael, tell us a little bit about starting an Anki routine.
Yeah, absolutely. So, as Tate beautifully alluded to, if you go back to the previous slide, you can see that I know they're on Anking V12 now, but if you go to the Anking Step 2 V, it might be either V11 or V12 tag, and then you go to the subjects tag, you can see that there are all these different subjects: cardiology, dermatology, endocrinology, epidemiology, GI, and we're trying to populate our rapid review series with each of these subjects. So you'll have a corresponding video to go along with the Anking deck, which I found was really helpful when I studied and really wanted something where I just had a single organized resource that had some comprehensive quick videos with the main diagnoses I had to know. So in terms of actually starting a Anki routine, what I would recommend doing is trying to do all the Anki cards at least 2 or 3 times during your co-rotations. But if you're already in dedicated, um, depending on how long your dedicated is, you probably don't want to be starting an Anki routine at that point, something totally new. But if you've already done all the cards 1 or 2 times, if you could get through another 1 to 2 passes of the cards prior to your exam, that would be amazing. And another thing some students like to do, I didn't personally like this as much, but would be to unsuspend cards based on their UWorld incorrects. And there's an add-on, or we'll put a video out soon that shows how you can search for your UWorld incorrects using the question IDs in Anki, because all the Anki cards are tagged based on their UWorld ID. So that can be really helpful, especially if you have incorrect questions in just figuring out what cards you want to do next. But really, in terms of Anki for step two, I think UWorld should really be your main priority once you've already been familiarized with all the information and you just want to do what works for you in terms of Anki. So you just want a reasonable schedule. You probably don't want to be spending more than 1 or 1.5 hours, in my opinion, doing Anki, especially during your dedicated prep. Prior to that, I think Anki is a great resource. But again, anytime you're doing more than an hour and a half, I would say, of Anki when prepping for step two, I think that's too much. So as Tate alluded to in this slide, consistency is a lot more important than volume for Anki. And one thing that I think is a weakness of Anki in terms of step two and in terms of clinical practice as a whole is Anki is amazing for step one. It's almost bulletproof in terms of step one because it's so much fact retention. But on step two, you'll have a lot of questions that require you to have a clinical gestalt or a lot of judgment calls. And sometimes in Anki, sometimes you'll say like a woman comes in with left lower quadrant abdominal pain, they're 21 years old, and you'll see the answer is ectopic pregnancy. But on UWorld or on the step two, that won't always be the answer. You're going to want to go through the practice of forming a full differential and then working through that differential based on the vignette and the data that you're provided. So that's why I think Anki isn't quite as strong, but it's still really crucial. And it's probably the second best tool, second to UWorld.
Absolutely. So, kind of with Anki, you have to identify your weaknesses and the most high yield information. So, a lot of times, like Mike kind of alluded to, you use your missed questions or analytics from UWorld. You can see what areas you're doing well in. And also, you just kind of got to know thyself. I have down there. Everyone has their weaknesses. You remember that shelf exam that just killed you, and you remember the ones where you did well. You need to be able to kind of reflect on that and know how to weight your time because honestly, with these dedicated periods, there's just not that much time to go around. You can't expect to spread it out evenly among every single system. You got to be able to decide where to place your time. So obviously, know thyself, determine where you're weakest, and then when you're kind of identifying high yield info, I would recommend first of all looking at the UWorld and Amboss comparison tables. So whatever QBank you like, UWorld obviously kind of being the gold standard, these comparison tables where you're able to take multiple different pathologies that may appear similar and then differentiate them based on like defining characteristics. These are often what's kind of tested with the Anki cards. And this is kind of the meat and potatoes of step two. You need to be able to identify pathologies and then differentiate them appropriately based on the findings that they give you, whether that be lab tests or exam findings or whatever. So with that, these are just a list of topics that kind of deserve their own specific emphasis. And specifically, Amboss has a lot of different separated little modules within it that kind of cover these different things, and that's really useful. But these are some things that aren't necessarily what you would expect to be super duper high yield, but they're becoming more and more important every single year. So things like risk factors, screening, ethics, biostats, knowing different things about the healthcare system as a whole, preventative medicine, legal medicine, all of these things that kind of go under the radar actually become incredibly high yield when it comes to step two. And you can put yourself ahead of the eight ball because a lot of people don't study this stuff since it's not necessarily covered in rotations every day and not necessarily seen on shelf exams. They kind of go into it blind from that perspective. So being able to handle these questions is really important. So, kind of along the last line that we had, you have to be able to analyze your mistakes. We talked about making Anki cards on your misses. We talked about redoing missed questions. A lot of people like to do that, especially after their first round through UWorld. And then watching specific videos on problem areas. Sometimes there is just a certain pathology or a group of pathologies that really have you hung up. In that case, kind of seek out some extra resources that might be able to help you over that hump specifically. Because learning from your mistakes is the key to growth. Very inspiring. I put that on the slide. This is my opinion, and I think this is a very useful thing to keep in the back of your mind when looking at step two as a whole. The dedicated period for step two should be more viewed as a time for optimization rather than for learning. In my opinion, most of the learning, quote unquote, learning of new content is going to happen during your clinical year while you're taking all these shelf exams and stuff like that. But when you go into your dedicated period, you should not be learning a lot of things for the first time. Now, some of those niche topics, like I just talked about, your ethics, your biostats, I get it. A lot of people are going to kind of cram that in that last month, and rightfully so. But this is really a good time to get back your test taking stamina. You're going to remind yourself of what you studied on rotations. You're kind of just refreshing your knowledge. And ideally, it shouldn't be the first time seeing this stuff. But like I said, maybe those niche topics, this might be the first time you're kind of seeing it and diving into it. Along with this, you're just kind of building your reasoning a little bit further. So that's really what you want to do. You want to walk into step two as the most polished test taker you can, because that's what counts. Your knowledge is going to kind of grow as you continue to do questions. That's you just have to keep putting in the work and the time. But the real thing that's going to kind of put you above other people is going to be your test taking skills. So this general approach, it will help you review incorrect questions much more efficiently. I made the mistake many times of just going through question blocks and I would write by hand a lot of the things that I would do wrong, almost writing the one liner of the question and then the high yield point to take away from that. That took a ton of time, and after a week or so, I realized that that wasn't going to be the way it was going to work for me during my shelf exams then on step two. So using kind of this method, both breaking down your mistakes, getting a general overview, and then finding the resources that work best for you, you're going to be able to focus more on the clinical presentation and treatment at hand as you do more questions rather than kind of what is this or what does this mean? What is this lab finding? You're actually able to put it all together and kind of form the full picture. So us as Strudel, and I think Mike would agree with this. We would
Totally
recommend two
agree.
complete passes of UWorld. So this is intimidating. UWorld has a ton of questions in that question bank, but usually how it played out, and this is how it played out in my case, one pass during rotations based on whatever rotation you were on, you'd be using that Q bank for the month or however long your rotation is. So I had a pass completed then. At some point, actually, it was during my last rotation, I reset the Q bank, which let me tell you, what a crazy transformational experience that is. Anyway, you reset the UWorld Q bank, go back to square one, and then you start your second pass prior to step two. So, although that is intimidating, I think it's very, very good advice. Practice questions are the best overall way to spend your time. People have been noting this all over the place. And I think that's just because you can practice active recall, your reasoning skills, test taking strategy, all in one shot. And also, you're simulating the test taking experience, which honestly, that's what we're prepping for. But this is my opinion. And this is something a lot of people are dead set on getting two passes of UWorld done, non-negotiable. But I would recommend if you're over 75 to 80% correct during your second pass, which is a pretty solid percent, trying a new Q bank or maybe moving into more NBME questions is very appropriate. And that's what I ended up doing. I kind of have a little bit on slides later. But what's really important to note is that if you're getting 80% of these questions right, the chances are that you'll kind of continue that trend, if not improve it as you continue to polish your test taking skills over the dedicated period. So it becomes a question of, are you going to grow doing this? When I was going through the question bank my second time, I started to notice, I didn't know if it was something kind of in the back of my mind, but I did recognize a little bit of the questions. Not necessarily everything, but after reading the whole explanation, I'm like, oh, I remember this. I struggled with that, and now I don't. So I was able to kind of show myself that I was learning, and maybe I needed a new Q bank to kind of continue to challenge me and help me continue to grow, learn new things from new perspectives. You any thoughts on that one, Mike?
I would say I definitely agree with the beginning part. Definitely agree two complete passive U world and the practice questions are the best way to spend your time. I will say if you are spending more than a minute and a half or even more than 75 seconds to a minute and definitely at 2 minutes per question, I think that's way too long. I think if you're spending that long on doing questions, then you should try to figure out what areas you're weak in and try to really hone in on those areas and get a stronger base. I think when you're doing practice questions, I would shoot for a minute a question because on the real question, you'll have things like drug ads and these biostats questions that take a long time to read and will take a lot of your time. So you'll know when you start getting to blocks, but you'll start running short on time if you're taking more than a minute per question. So part of that will be the question taking strategy that we talk about in a second. But if you're finding that you're just not remembering something, then I think you should I think it's a good time to just kind of watch a quick review video and do some of the Anki cards just to build a base, just so you've seen everything a few times. And
Yeah.
now, in regards of Tate's opinion here, if you're getting 75 to 80% correct during the second pass, I think if your goal, which I think was Tate's goal, was to get the maximum score possible, I think that is totally appropriate. Try me questions, I think that's totally appropriate. Personally, I think I was getting 77 or 78% on UWorld the second pass, doing them pretty fast because I was in rotations when I was studying still. And I just did some NBME practice tests, and I think that was totally sufficient. So I was, because the thing is, UWorld is the closest question bank to step two if you exclude the modules. But the way things like ethics and um, quality and safety. AMBOSS is a little bit better for those, but in terms of the question format and how the question's written, UWorld's certainly the closest to the actual step two itself, in my opinion. So I think if you just wanted to stick with UWorld, that'd be totally okay too, and just do like one or two of the practice NBME step two questions. Because if you're ripping like 77, 80% on the UWorld question bank, you're probably in those 260s, 270s range and you'll have a better idea once you take the UWorld practice tests.
Yeah, I agree with that. So self-assessments and prediction, it's a very important part of the dedicated period. In general, the best practice exams to take include the combination of these few. So UWorld self-assessment 1 and 2, the MBME forms 9 through 14, they're kind of the increasing number is increasing in how new they are. So 9 through 12 are kind of the older set that were considered kind of the gold standard, but 13 and 14 have kind of been added and have seemed to be pretty relevant and accurate But either way, going through them is going to provide a good way of seeing more how the NBME asks questions versus UWorld, which can be useful. The new free 120 is something that everybody should do, especially closer to the exam. And then I would also recommend Amboss every year sends out a free self-assessment very, very early on. I don't know what month it is, but I know it was like 6 months or so prior to my exam. But it is a decent way of getting a free chance at just going through and seeing where you think you're at and how you feel. That way you can kind of start to tailor things as your clinical years kind of come to an end. Um, Now, this is what I tended to do, was to focus more on the NBME forms within 1 to 2 weeks out from my actual exam. The reasoning for this is just the wording of it is a little bit different than UWorld. The vibe, if you will, is a little bit different than UWorld. And even more closer to the exam than that is the free 120. Now, that's what I decided to do. I'm not sure, Mike, where do you stand on that?
I think this is totally exactly what I did. So I did UWorld 1 and 2, and we could talk about what we got. I don't know if we have a slide on a tape, but we should talk about what we got on each of these and then what we got on the real exam,
Yeah, maybe we
just
have
for
to add
transparency.
a another video on that because that would be a good idea.
Okay.
But with that, kind of score prediction. So this is something that you can kind of get lost in the sauce of, in my opinion. Amboss has one, and then there's this predict my step score. For my score, Amboss was actually right on. It predicted it exactly. So I was very impressed by what Amboss was able to do. I was also within the confidence interval on predict my step score. So really, you have to consider the confidence interval. Both of them have pretty decently wide range of confidence intervals, and that makes sense. There's a pretty wide confidence interval on step two as a whole. So you have to be aware of that. So don't take it as gospel. Don't say that since your score predictor said you were doing awesome, that you can just kind of be settled down and kind of slack now. But in the same way, if it says that you're not where you want to be, those are all kind of they're not perfect predictors. So I would kind of take them with a grain of salt at all times, but it is a decent way to kind of check where you're at and see, on what test, if you would have done better, would you be able to kind of mess with things? There's always things to consider, but just
Well,
take them with a grain of salt. Don't get too hung up on them.
Tate, go back a slide real quick. Tate, your Amboss score, how long ago? I never took that. It predicted you get 274. How long,
Yeah.
when did you take it? Before your
No,
step
no, no,
two?
no. It has a calculator in Amboss.
Oh, I see.
Calculator where you can like the same thing as predict my step score.
Oh, I see. I
And it got
gotcha.
it
I
right. It got it
gotcha.
right on. I
I
think predict my
gotcha.
step score
I
said I was
see.
getting, but yeah, yeah.
I
It was like
gotcha.
1 point
Okay.
off, but yeah, both of them are pretty good in my
Gotcha.
opinion.
Okay. Yeah. So I'm just gonna quickly talk about what I got. I think UWorld 1, I think I got like a 258. UWorld 2, I think I got a 262. NVMe, I think I did a 11 and 12 maybe, or 10 and 11, and I got a 274 in both. Free 120, I think I got 81%. Free 120 is the closest thing to the step 2 ever. It's the closest thing. It's put out officially by the USMLE. It's the closest thing you'll get to the official step 2 exam. And I think I got like an 81 or 82% on that. So I was predicted, I think, to get a 268 or 269, and I got a 271.
Yeah, I'd have to look and see what my scores were. But yeah, the score predictors are not bad, and free 120 is definitely like what you should take last.
Yeah, absolutely. Totally
So
agree.
this is the step two master checklist. So this kind of combines all the what we've talked about and then now focuses it in on this checklist. This is what we would recommend you have done when you walk into step two. So first of all, using those overview videos, like I said, shameless plug for Strudel. We're trying to do this kind of thing to provide that for you guys. 2 passes of UWorld or one plus the starting of another question bank. That's on your discretion. Review your incorrects with a method of your choice. Do your daily Anki reviews if Anki is for you. I would recommend completing 2 to 3 MBME forms. Look at Reddit for your particular year, whatever year it will be, or whatever new forms there are for the best ones. I would complete UWorld self-assessment 1 and 2. Those are pretty ironclad when it comes to being a decent predictor. Complete the new free 120, maybe even the old free 120. I remember doing that one as well. But the free 120 is definitely what you should do last prior to your exam. And then this is actually kind of something that a lot of people are kind of starting to catch on to. The Amboss modules, such as like high yield ethics, stats, quality improvement, they have these modules and they are very, very good at giving you some practice questions in these areas that a lot of people are sleeping on. You can also support these videos like I did with Divine Intervention, who has some great, great videos on these topics that really are starting to become tested more and more often on step two. And then lastly, but definitely not least, you got to plan for your exam, guys. You got to know when you're taking your exam, where you're taking your exam, the logistics of that. Source of caffeine, we're all addicted, it's fine. And then snacks during the exam as well. I know Dirty Medicine has a great video on like biohacking on exam day. I used that for both of my exams, so it seemed to serve me pretty well. But also, you just kind of got to be in the right headspace. So, whatever that looks like for you, do the things that make you well, do the things that help you focus, and go into that exam knowing that you can do it. So, Mike, kind of talk to us a little bit about the sample schedule, and then I believe yours comes up after it, what you actually did.
Yeah, so this is like my dream schedule, like if I were to have a perfect schedule for my dedicated, this is what I would have done. And this is what you should aspire to do because I mean, we all set goals. It's very hard to actually land exactly where you want to. So if you set them a little bit aspirational sometimes, even if you're a little bit far off, it'll still be a great schedule. So ideally you do one question, 40 block question in the morning and then take a little bit of a break, maybe like 30-minute break, go walk outside. A lot of you are taking step two in like spring or summer, so it should be bright out wherever you are by then. So maybe go on a walk outside, do another 40 questions, then you do some incorrect reviews early afternoon, and then you spend an hour and a half on Anki after you do your incorrects. Um, and then you can review resources as well. So whenever you're reviewing incorrects, always read whatever the explanation is. But if you're still a little bit confused, I would always look it up in a reference text. So that could be like Amboss, or honestly, Google's pretty good, or ChatGPT is honestly getting pretty good at this point. But the other main ones are like Step Up to Medicine is a very good reference, and First Aid as well. So any of those would work. I think the main one, if you do have Amboss, I would recommend that just because it's the easiest and it'll probably have a comparison table. Then a little bit of Anki in the afternoon, eat dinner, go walk around again, and then maybe have some family time. Then do another question block. Again, always do these UWorld blocks tutor mode just so you can learn in real time. And then at the end of the day, do a review of any topics you missed. And then really the key thing for the end of the day is identify if there's anything you feel like you're weak on and identify those weaknesses for the next day. And then my general tip for studying in general is that you want to plan breaks into your schedule because you're going to take breaks no matter what, and you don't want to see those breaks turn into from like a 25-minute break into like a 3-hour break. That's what can really ruin um, your plan for the day. So if you just schedule those breaks in and know that you have a 30-minute break coming up, look forward to the break, take the full 30 minutes and just fully relax and then really lock in and focus on those UWorld blocks. It'll help make your studying a lot more productive. So here's my actual schedule. So I fly through UWorld. So I would do like three 40 question UWorld blocks in the morning, and then I would just review the questions as I went by. I didn't really review my incorrects as much because I would review them on the spot, and if it was a content issue, I would just look it up right on the spot. And if it wasn't a content issue, I just would kind of um, just see if there's anything I need to change about my test taking strategy. And then from like 12 to 2, I would just kind of hoop or like eat lunch. I lived with my brother, so I would go mess with my brother a little bit. And then I would do some incorrect review some of the time. Sometimes I just kind of took a longer break up until 2. But then by mid-afternoon, I would definitely hop back on the UWorld grind, do another 40 UWorld. I didn't do as much Anki during my dedicated because I'd already seen the cards 3 or 4 times. And like I said earlier, I don't think you gain as much utility once you already have the ability to build differential diagnoses. And then I would do some more uh, UWorld, then I'd have some dinner, and I'd complain about having to study. And then I would do a little bit of review, and then I would kind of just chill the rest of the night. So really, my day was like kind of from 9 a.m. to 6 p.m. And then I would think about what study topics I want to do for the next day, or plan out how many UWorld I wanted to do. I think I had like maybe 10 or 15% of UWorld done when I started my dedicated and then was able to finish all of it by the end of my dedicated. So I was just like flying through questions because I already felt pretty solid about my foundation. If you watch my shelf review video, you'll see that I was averaging pretty high scores on my shelves. So you can see that I had a pretty strong foundation. So that's what I did. But I also took step two pretty early, but there are a lot of students I talked to and a lot of people who scored in the 270s as well who didn't have a strong foundation and just took an additional month or so to build their foundation before they took their dedicated and eventually step two. So I know a lot of people take step two like in July, June, July, August even, and I took it in March. So I took it pretty early. So I just wanted to get it done with. because I was actually switching specialties, which might be a different video, but that's what I did. So I just really tried to hit the UWorld really hard.
Absolutely. So here's my actual schedule. Here's what mine look like. Obviously, I did the same thing as Mike did um, at the start. So start your day with a couple UWorld blocks while you have the stamina. So I would do something kind of different. So I love tutor mode on UWorld, but I noticed after a while that my issue was that I was just taking too long doing the questions because I knew I could. So what I ended up doing was I would do a timed block. It would help me get through it pretty fast because you'd be limited to an hour, and then I'd be able to review that block within 30 minutes. So in an hour and a half, I would do a 40 question block timed. I'd practice all my reasoning, and then I would review it right after to kind of have that learn in real time aspect that Mike was talking about. So and after those two blocks, I'd usually unsuspend new Anki cards. I was a big believer in Anki cards, and I still did spend a decent amount of time on Anki cards. So this would usually look like about an hour to an hour and a half a day. Like Mike was saying, it did go over every once in a while for me, but I didn't like that. I would aim for an hour to an hour and a half. I think that's a solid recommendation. From 12 to 1, I'd have lunchtime with my family. I just had a little one at this time. So it was, a good time to just kind of decompress and spend time with them. 1 to 2:30 p.m. I do another UWorld block, but usually now that it's in the afternoon, I'd go a little bit more low key tutor mode, get through it in about an hour and a half. From 2:30 to 4, I'd schedule a workout into my day with an overview video of my choice. I'd kind of go through and plan how I wanted to do these out. Obviously now I wish I had strudel. This would be a great time for strudel. But at the time, a lot of this was divine intervention. I really buy into how he teaches and how it ends up translating into step two practice. From 4 to 5:30, I'd be showering, doing stuff around the house, kind of taking a break there. And from 5:30 to 7:30, I'd be doing dinner with my family and then possible bedtime. So really, that whole block there from 4 to 7:30, I really wasn't studying. So I did schedule that time out in my day. I knew that that's what it was going to look like. So I would definitely recommend if you have commitments, like schedule them out, block them out in your day, just so that when you're not doing those things, you're extra productive during that time. You know you're going to have the break coming up. From 7:30 to 9, I'll review some missed questions. I'll polish up anything that I didn't get done. Every once in a while, I'd squeeze in an extra question block, maybe with a different question bank or something like that. And then from 9 to 11 p.m., I'm kind of a night owl, so I'd stay up a little bit later, but obviously I had a young child at this time, so I wasn't too ambitious. So I'd chill with my wife, do some gaming, stuff around the house, stuff like that. Some notes about my kind of journey when at this time, I was already partway done with UWorld Pass 2 because I took the whole month before my dedicated period that I took off from rotations. I was on a lighter rotation, so I actually had started my second pass of UWorld during that time. And I only ended up getting through about 70% of the Q bank before I stopped and focused on MBME forms, AMBOSS, or other things because I thought my UWorld scores were sufficient. And like I talked about, that was somewhere around 75 to 80%. I'd have to look back and see what my actual score was, but that's where I'd consider the threshold for that little idea that I had. So
What
now this section of the video, we're going to jump into some frequently asked questions. This is kind of the last part of the step two write-up and overview video, and then we'll kind of do a separate section on the anatomy of a question and how to break it down and reason through it. So for these
Tate,
FAQ,
what month did you take step two?
oh, I took step two, I believe it would have been in June, late June. I took
Okay,
the month of
nice.
June off, and then at the end I took that, and then I started rotations back in July.
Nice. Okay. Yeah, I'm just asking because it just means you have time to build up your base too. So if you identify, if you know you want to do, uh, you do really well on step two and get a really high score, you just want to identify, a couple months in advance before you're planning to take step two, how you're planning on doing. And if you're not as strong as you'd like to be, then you want to build up your foundation prior to dedicated.
Absolutely. So here's our frequently asked questions section. We'll hop right into it. Why should I take step two as a DO? So this is something that I can kind of speak to as a DO student, as a DO applicant. Some programs just straight up require step two. You want to leave as many doors open as possible if that's your goal. For me, that's something that I felt was very important. I didn't want to find myself without options. So I needed to have this exam under my belt, regardless of, its extra cost and stuff like that. There are more MD than DO applicants overall, so more people take step two. So therefore, it's kind of allows for a better comparison between applicants. It's more standardized because if you start with more people already taking step two, you might as well have, everyone take it to make it a little bit more of an accurate comparison. Once again, it's not required at a ton of programs, so don't think it's an absolute 100% mandate, but it's just something that I took into account that just it provides a nice equal ground for these programs to look at. This also allows for a chance of distinguishing yourself if class rank or GPA is not really done at your school, or if this is not a strength of your application. So if you're somebody that maybe wasn't where you wanted to be when it came to your GPA class rank, or if you didn't have one at all, this step two score allows you to kind of put yourself out there and show what kind of student you are. And this can go a long way as far as distinguishing yourself from your peers, which and earn more applications based on those cutoff scores, more interviews, excuse me, based on those cutoff scores that we talked about earlier. So why should I not take step two? This is another question that I get a lot. Some programs straight up don't require it, and there are specialty dependent differences. So some programs have a lot, some specialties, excuse me, have a lot of programs that don't require step two. And sometimes these less competitive specialties also place less emphasis on step two. So it just might not be in alignment with your specific goals. So once again, this is a good opportunity for just some self-reflection. If you don't think that you need it to get where you want to go, trust yourself. Talk to a trusted like medical school advisor, talk to kind of some administration, or at least what is your school kind of saying, or read around other like people's perspectives on UWorld or on sorry, UWorld. I'm just really in that mindset on Reddit or something like that and see like what people are kind of saying about this. In my opinion, I think that if you're in these less competitive specialties where there's not as much emphasis on step two, it's not required. You don't necessarily have to take step two. But in my opinion, even if I was doing one of those less competitive specialties, I would have taken step two regardless, just because it doesn't close any doors. It if anything, provides more open doors. Now, that is kind of complicated by this next point. I would not take step two if signs are pointing towards a chance at a suboptimal score or possibly failure. So in general, COMLEX, the DO version of step two, level two, has a lower overall passing standard, so there's less chance of failing. And really, this comes down to in the match or in ARIS, you can't not report a failure or a bad score. You can't just be like, oh, well, this program doesn't require USMLE, step two, so I'll just send in my level two, which is a passing score. I don't have to tell them that I got a really bad score on step two or if I failed step two. That actually, I know it's kind of a gray area, but I think from my interpretation of the rules, would kind of be a match violation, which is a terrible, 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 terrible thing. I cannot emphasize that enough. You want to avoid that at all cost. So if that sort of scenario fits where you're at, I would recommend kind of not taking step two and focusing on Comlex. And the other reason, and it is kind of a reality of the situation, it's expensive. As a DO student to take both of these exams, level one, level two, step two, it's an expensive thing to do. There's a lot of logistics involved. Sometimes the schedule wasn't completely optimal for how I wanted to study, and when I wanted to take these exams. So it's all things to be kind of keeping in the back of your mind when you're making these decisions. So when should I take step two? And Mike kind of alluded to this already. It kind of depends on your comfort level and your readiness. Mike talked about his shelf scores saying like, hey, you have a really good foundation. You're ready to kind of go into this. What's your UWorld telling you? What are your practice tests saying? What did your shelves tell you? Honestly, earlier in your clinical years is probably better. There's just more proximity to your shelf studying. So I took it in June right after I had just finished the third year. But every institution is different, especially these days, on how they schedule out their clinical rotations and when you take step one and step two. So really do what works for you on your schedule at your school. Consider whether you get a dedicated period or not. Can you schedule some off time? We, as a group, would recommend about 4 weeks of what I would consider dedicated period or a light clinical rotation to prepare properly. I think that's just a decent time to kind of explore all of those checklist items that we listed earlier to kind of make sure your foundation's solid, to get the right amount of practice tests done, to really feel comfortable as you go into that exam. And sometimes another thing to kind of keep in mind, your away rotations or your audition rotations can make this kind of tough. Sometimes if you have a sub-I coming up and you know that's going to be a more labor-intensive rotation, you're not going to want to have to be in dedicated studying your butt off for step two. So make sure you can try to schedule it so that you can kind of avoid that. And when you're on those aways or auditions, if that's something that you're planning on doing, this doesn't interfere. So Mike, kind of tell me a little bit about how step two is different from step one.
Yeah, so now I of course the big thing is obviously step two is scored and not pass fail. In terms of the exam itself, then you really want to be thinking in terms of there's a difference in terms of the question style. So there's a lot more like judgment call questions, clinical questions, kind of vague um, prompts, and then you need to figure out a best next course in action just based on your judgment and what you've seen both in the clinical setting and what you've seen from the question banks. And there's a lot more like kind of what I'd call fluff. Like there's a lot of like weird stuff that we talked about. So there's a lot of ethics, biostats, there are a lot of drug ads, epidemiology, things like that, rather than testing. So the fluff of step one was like, this patient has heart failure. What is like the muscle, like what gene is dilated or like what gene will be upregulated in a patient with some random physiology? Now the fluff in step two is like biostats, epidemiology, things like that. In terms of the bulk of the questions themselves, you'll get a lot of questions that are like, what's the best next step in management? What's the next most appropriate step or imaging test? What's a natural course of the condition? What's a appropriate screening regimen? What are This is very, very high yield. I'm really glad you included this, Tate. Which risk factors predispose the patient to this pathology, and what condition or findings are associated with this condition? These are very, very important questions and things you really want to be thinking about as you're studying. So even when I was studying, if I saw something like peripheral arterial disease, I'd want to make sure I could answer almost all of these questions for each major diagnosis. I know like there are a lot of fringe diagnoses you don't need to know everything for, but for your core diagnosis, COPD, heart failure, peripheral artery disease, things like that. You really want to be able to answer all of these questions. And then step two will have a lot of longer question stems and more information. So you want to have a good protocol to be efficient when analyzing these questions and answering these questions. And we'll either go over that in this video or a different video. But essentially that boils down to my method is I read the first sentence and then the last sentence, and then I form my differential and I want to identify what the question's asking from me. So I already basically have a differential diagnosis. And then I read the rest of the question and just garner out any pertinent tips like positive pertinence, positive negatives, and I form my what I think is the diagnosis, and then I answer whatever the question wants me to do. So whether that's next best step in imaging, natural course, uh, predisposition, risk factors, screening, things like that. Uh, and then again, there's more fluff, and it just keeps going up. And step three will also have a lot of this fluff with the ethics and biostats.
Okay. So how do you balance rotation and studying? Also a very common question. This is my tip for this. So I kind of designed my schedule to have non-negotiables in it. So these are things that I got done every single day, regardless of how bad the day sucked or how busy I was. I would do my due or my new Anki cards and my allotment of questions per day. It would depend on the rotation. So take your total numbers of questions in the Q bank for your rotation that you're on, divide it by the amount of days until your self exam, and that's your goal per day. That's your non negotiable goal per day. So that way, no matter what, you're going to see everything in the Q bank before your self exam. The other thing I would do is utilize your downtime. So I kind of talked about this earlier when I went into overview videos. So do these kinds of things while you're driving, doing exercise, things that are going to happen anyway in your day. You can end up making them kind of productive and learn during that time. What I would use on rotations would usually be Amboss, to be honest, as my on-the-go reading and my question bank to get more questions in. So I kind of made UWorld, I kind of made it sacred to the point where, like, if I was doing UWorld questions, I was laser focused on UWorld and that only. Amboss, I would pull up a set of 10 questions and I'd try to work through them throughout the day. If I was eating lunch or doing whatever, and I wouldn't do that every day. It was just if I had some spare time on my hands. And Amboss is very similar to up to date in terms of like being a resource where you just search something and see what pops up. But Amboss is much more concise and relevant for exams. You can even suggest that you or select the student mode that really suggests the high yield things for exams specifically. And then the other thing I would note during clinical rotations, learn about your patients, learn their pathology and their management. I know that this makes me sound like an old head. This is an old head fact,
Hmm.
but this is just something you got to be able to do because the things that are going to stick are the things that you see, and not everyone's going to see the same things. So that's something that you have to consider. You're not going to see some of these zebras. Some people might, and then you memorize this for life. You remember it was very impactful for you. But you got to be able to kind of see things and learn from them while you're on rotations. Don't just kind of blow off rotations as something you have to do. Actually, kind of learn about your patients, talk to the docs, talk to the residents, and then reinforce it with your own work and your own reading. So, what resources were most helpful or slept on, in my opinion? So, I already went into this, I already kind of gushed a little bit about divine intervention. I think he does a fantastic job. He's super detailed. He has sections for each shelf exam, dedicated videos to ethics, the biostats, the stuff like that. I rewatched these videos several times in preparation for step two. There's a list on Reddit if you want to go find it, where it basically says, like, oh, these are the best divine intervention videos to watch prior to step two. I took that and I scheduled it so that I would be done with them like a couple rounds of them prior to the exam. And I think he did a great job. In my opinion, he's one of the people that talks the best and his content most reflects how step two tests things. And we're trying to do a similar thing here at Strudel, but Divine Intervention is very, very good. I'd highly recommend him. Q banks. UWorld is the gold standard, and that's kind of the end of the discussion right now. In my opinion, I think Amboss has great specific sections, like the ones we talked about, ethics, biostats, etc. But I think its QBank is very much slept on. I was impressed with the quality of the questions and how well it actually applied to step two. It is a tougher question bank, though. In fact, no matter what the specialty, whatever shelf I was on, my scores would be 10% lower on Amboss than UWorld without fail, every single time. I think it's a tougher Q bank, but I really do think it teaches you how to think, and I do anticipate it's going to become more and more popular because it is kind of an all-in-one encyclopedia, Q bank, everything all tied together, and I think that's very, very good and very appealing. The other thing that I really used, I got a lot of good use out of early was online med. So he does a great job putting everything on from a specific rotation, the most like common bread and butter pathologies to learn the step two content for the first time. Because to be fair, learning content for step two is different than step one. Mike already kind of alluded to that. So being able to kind of see how he would walk you through it, he kind of has a method where he, he'd start with your presentation, how do you diagnose it? How do you treat it? That's how you have to be able to think about all these pathologies. And he does that very well in a whiteboard format. Um, and I think that that's very useful, especially early on in your clinicals to kind of see how to learn that way. The other recommendation that I would give people is Dirty Medicine, especially for specific topics that need memorization. He has some good memory hooks, and he also has a solid OMM series for osteopaths taking level two. And that's actually very useful to give yourself a reminder on that content because it is pretty high yield on test day and you got to know it. Any resources that you use, Mike, that you think should be added to this list? These are just the ones that I think need to be considered for most folks.
There is this resource, not to plug our channel or
Don't
anything,
do
but
it.
called Strudel Medicine
Oh
Reviews.
boy.
That's pretty good. But
Yeah, I've heard
otherwise,
good
this was a
things.
good list.
Very good. So then there's this question, how do you cover those abstract, these niche subjects that we've mentioned so many times yet in this video? So these are the ethics, the biostat, stuff like that. So we've already kind of gushed a little bit about AMBOSS and their articles and question sets that go specifically with these things. Would highly recommend if you have the ability to get AMBOSS. Redoing the UWorld questions specifically over these topics, you can filter those out and do them. Emphasize these drug brochure questions and the research article questions where they present an abstract and stuff like that. Those are becoming so high yield. I think I had one like set of three questions per block on step two that had something to do with a drug brochure or a research article that was strictly like biostats, and you had to know it. You just have to. Um, Divine Intervention podcast, like I mentioned, has a great section on ethics and biostats. And the thing he does very, very well is he fits the USMLE Step 2 blueprint very well. He covers the same things that they say are high yield. So that I view that as a very strong part of his work. And then the Dirty Medicine videos, he has a really decent set on ethics as well. Really, what I was doing when I was studying all these ethics stats and stuff, I was finding as many resources as I could and just kind of putting them all together hopefully to get a better understanding quickly before my exam. Because to be honest, you don't really have the time to study it during your shelf exams. So this is kind of a time to cram, if you will. So having a bunch of different resources and finding what works for you and then kind of memorizing it, at least shoving it in your short-term memory for the test is a very, very good thing to do. Because like I said, they're tough topics to study and a lot of people just don't study them. So they end up being free points on these exams. Anything to add, Mike?
No, you covered it, man. Well
Awesome.
done.
So, what would you tell students not to do when prepping for step two? So, the first thing I would say, I know I've already talked about Reddit a couple times, but I would stay off Reddit as you get closer to the exam. I don't want to see you guys searching and looking at these guys that are talking about how they got a 287, just mauled the exam, killed it, didn't miss a single question, whatever, and all the things that they did or said they do. Not that people on Reddit are inherently dishonest, but just don't get in your own head about this. I would not switch things this is the third point there. I would not switch how you do things if it has been working. I would not completely like adopt a new Anki strategy when you've never used Anki a day in your didactic years or your clinical years to this point. If it ain't broken, just don't fix it. Just kind of continue on your way and get the reps in, put the time in, and it'll reward you. Don't ignore these niche topics like we talked about. We've said this multiple times, so I hope you guys get the importance of it. Ethics and biostats and those kind of niche topics, they're becoming more and more common. And like I said on the last slide, many people don't study it enough. You can pick up free points, and they're weighted the same. It's the same weight to get an ethics or a biostats question as getting a basic sciences question back. And I think it's easy to kind of view them as less important, but they're really not. And then don't put all of your time into studying. Like I mentioned in my plan, I had a young family at the time, and we were, there was extra time for bedtime, and I wanted to spend new time with my little girl. I had things to do. I had hobbies. I wanted to exercise every day. All of these things have been shown to increase wellness, have been shown to increase your results on these exams. So I know that it's called the dedicated period, but don't 100% just head down, never go outside, lo-fi girl in the background, never see the light of day again. I would definitely recommend carving out time for the things that are important to you. Anything to add, Mike?
I would say don't take the exam in Nepal either.
Oh, yeah, that's a good,
Yeah,
that's
don't
good
schedule it
advice.
there. All right, thanks for watching. Peace.
Peace.